Amajuba Child Health and Wellbeing Research Project, abbreviated as ACHWEP, is a 3-year study that had conducted in Amajuba District to look at the impact of what happens when children lose their parents. In short, the results show that all children are vulnerable, whether they were orphans or non-orphans.
I think when you work with children holistically, and there should be no single department that can fulfill assist a child singly.
Ushukuthi usibusiso wafika isikhathi kwakade kushone umama wakhe.
La umama maqeda kushona shuthi umalume waseyahamba ema-social workini wafika wabhalisa ukuthi angasiholela ukhona ungasigada.
Ingane siba-4 then mina nami neyami ingane nosisi wami nengane shuthi sesiba-6 sihlala sodwa asina mama baba kumuntu asinabantu sisapotayo nengane aziholi ama-grant zonke nosisi wami unenkinga ye-ID. Umbali-ke nje yena umbali nje yena kahle kahle uhanjiswe isimo ukuthi khulutho yabo so asibabona ukuthi ngahamba ngihlala emsingabandla zokhona.
Indlela esiphila ngayo la ekhaya ayikho right, kodwa ke nkathi umama esasekhona yayingconywana ngoba yezama amatoho emzini abantu esebenza nasey'ngadini. Umalume wayesiholela imali ye-grant.
The challenge at this stage is one department plays their role, but because they are not speaking to each other, so the assistance or the support is limited. The Department of Education, Social Development, Health, Agriculture, all have feeding schemes. But if you look or ask the communities, they always cry of the shortage of food, either funding runs out or if there are food rations that the children access, they are never enough. But yet we have, it's not that they are not doing it. I think it's the how this is being done.
Ayikho enye indlela esingabachazela ngayo. Kwa-social welfare ukuze sithenge ukudla kwabantwana siyacela kuqala senze i-requisition bese kuba yibona abasiphendulayo ukuthi sekumele nihambe niyothenga ukudla kwabantwana. Uma bengakasiphendula sikuthengi siyahlala silinde bona noma ngabe i-checkbook sinayo asiyisebenzisi bengakasiphenduli. Manje abantwana sesinabo 150 bayeza ngo-11 bafike badle idokwe noma izinkwa netiye bafike na-after school badle. Uma befika abantwana noma bangafika bebe u-10 kanti ukudla besikubhajekthele laba asikwazi ukuthi sibaxoshe abantwana ngoba basuke befika vele benenkinga belambile siyaqhubeka sibanike kona lokho kudla. Yingakho ukudla ukuthi kusheshe kuphele. asisho ukuthi jika uzoqala ngenyanga ezayo ukudla sobe sikubhalile phasi sesikubudgetele ukuthi nawe usungadla nekhaya cha siyaqhubeka sibaphakele sicela ukuthi nisibekezelele nathi asizenzi
ukudla namhlanje kuphelile bebengakasiphendula ukuthi sikuthenge kodwa sonitshela mase so phathisa nasesikoleni banitshele ukuthi sekukhona ukudla seningabuya nizodla kusasa nizi namhlanje angalukho no kodwa sozama ukuthi sibatshele abala eduzane ukuthi banitshele ukuthi namhlanje siyadla nizodla nini nabahlala lekudeni sobatshela kusasa niza langa namhlanje kuphelile amapapa akhona ishema
nje umntwana akakwazi ukuthi amukele inkinga onizomtshela ngayo yena utshela ukuthi ngizodla
The interactions with government, politicians and other organizations and from the communities themselves is that integration is a challenge.
Every department has its mandates and its policies. Now, for example, we have 2 drop-in centers now called community care centers in Matideni. We have a great challenge, especially in the sense that we don't have structures.
The challenge that is there is that much as we can have budget and the Department of Social Development has budget for these projects, you find that the criteria that is being used is not the same. The Department of Social Development is satisfied having identified that there is a need. With the Department of Health, there has to be an infrastructure. You find that the Department of Social Development is ahead of us and we lag behind because we cannot support an IP site if those specifications, if that criteria is not met.
Up until you don't have a structure, the Department of Health cannot fund that project. So as a result, there's no progress for food and other aspects of the community care center.
Project siqale ngo-2007 nama-orphans futhi maningi kakhulu kule ndawo. I-death rate i-high due to HIV and AIDS. So sabona-ke ukuthi kuzosisiza kakhulu nathi ukuthi siqale le-soup kitchen ezokwazi ukusiza abantwana ukuthi mabaya ekuseni esikoleni bakwazi ukudlula la bathole i-breakfast noma sebebuyile esikoleni bathole i-lunch yabo la. Ukuthola ukuthi enye ingane ayi-holy grant, i-social grant, isizathu sokuthi ayinaso certificate. Lokho kusuka ukuthi mhlambe ingane umzali wayo wayishiya ekhaya wayihambela wayegoli. Manje masifika eHome Affairs mawuthi uzomthathela umntwana i-birth certificate kuthiwe bafuna umuntu azalana naye. So wena njengelunga nje lomphakathi awukwazi ukuthi umthathele. Ingane zisuka la zihambe amabanga amade njengokusuka lana uhambe uyodla ngale esiyanakekela. Baphinde mabebuye esikolweni bahambe ibanga elide bebuyele beyodla bezokhathi bebuye emakhaya. Sike saya ku social development siyofuna ukuthi bakwazi ukusilekelela ngoba u-social development uyena oyayabhekelele kakhulu ingane. Sike saya khona into efike yazivimba khona uthi mawufika lapha bafuna ama-document amaningi njenge-business plan bethi angeke baze bakusize fanele ukuthi uze ube ne-business plan. Siqhubekile salima satshala ukuthi sikwazi ukuthi sipheke ukudla sibanike abanye nakuba manje sikaqalisa ukuthi ukudla sikupheke ngenxa yokuthi kwale building yethu ayikho esimeni sokuthi singakhona ukuphekela ukudla ku-health. Siyakwazi ukuthi sibakhelele lapha kwi-project yasengadini sibahambisele emakhaya amabecela yiloko esibasizayo. Ngaleso isikhathi siyahamba uthola ukuthi futhi thina asinalo ulwazi ukuthi i-business plan ibhalwa kanjani. Awuyazi nalo business plan nokuthi uzoyiqala ngakuphi kodwa unalo uthando lokunakelela abantwana. Ngalesikhathi usayozamelela ukubhala i-business plan umsebenzi wawuqhubeka abantwana still balambile la emphakathini umsebenzi wawuqhubeka umile.
The government and other NGOs are working, to make an improvement, but there are no practical systems and mechanisms, to ensure that this happens.
We've established the NIP Forum, which consists of all stakeholders. But the challenge there is I don't think every department is aware of the National Integrated Plan.
We need to avoid planning in silos. For instance, if the Department of Education is planning to build a school in point A, and Department of Transport is planning road to another point, it would assist if these departments were focusing in one area, because transport would be providing road to the school and municipality would be providing water to the area, and the same municipality would be providing electricity to the area. So we will have a school with infrastructure. Then we would see the properly integrated services going to the needy communities. If plans are not integrated, services become duplicated for one and a specific area, only to find that there is an area that is being neglected.
We need to have all the departments on board. The Department of Education,
the Department of Agriculture,
the Department of Social Development,
the municipality,
SAPS,
Public Works,
the Department of Health,
Department of Transport, Department of Home Affairs,
the Batupili principles are saying a lot to say, as a government, these are the things we stand for and the values as well. Those should be known by everybody in the department.
I think Amajuba District has great potential. We are not a very big district. Much as we have the areas that are deep rural, but even in those areas, we do have NGOs. I do believe if all the sectors and the civil, organizations can work together, the children can benefit.
Mina ngicabanga ukuthi ngomndeni wasekhaya ngicabanga ukuthi sibuyelane nje sihlale sonke sazane futhi ukuthi usisi ubhuti ubani simazi umuntu omdala ukuthi uyena kubani, kodwa bengifisa ukuthi sibuyelane sihlale sonke la ekhaya.
Mhlambe njengoba kunesithi sodwa mhlambe sinjena sihluphekile nabo bonke ke nje laba abanye nabo abangekho right ngathi government nabanga angaba ba usizo kubo. Futhi nangokuthi ke ngibone njengathi thina sesilahle ithemba, sibone singafani nabanye abantu, sibone nje siyithi nje singafani nje nabanye abantu ngendlela nje siyodwa nje. Ngicela nje abanye abantu nabo bangafani nathi.